Measuring the left ventricle is the bread and butter of adult echocardiography. Getting these right is the difference between a routine checkup and a critical diagnosis. Here is a step-by-step breakdown of the 5 key measurements, how to perform them, and what those numbers actually mean. Normal values mentioned may be considered only as representative, as actual value can vary with body habitus and the population under consideration. LV linear dimensions, that is internal diameters. This is the starting point for assessing LV size and volume. It is typically performed in the parasternal long axis view, often called as Plaque's view. Use 2D guided linear measurements. M mode is less preferred now due to off-axis errors. Measure at the level of the mitral valve leaf tips, perpendicular to the LV long axis. LVIDD, left ventricular internal diameter at end diastole. LVIDS, left ventricular internal diameter at end systole. Normal men have it less than 5.9 cm and women less than 5.3 cm. Values above these thresholds suggest dilated cardiomyopathy or chronic volume overload, as in severe aortic regurgitation. Left ventricular wall thickness, septum and posterior wall. Assessing the thickness of walls helps differentiate between a healthy heart and one struggling against pressure. This is also measured in the parasternal long axis view at end diastole. IVSD, interventricular septal thickness, diastolic. LVPWD, left ventricular posterior wall thickness in diastole. Normal is less than or equal to 1 cm in men and less than or equal to 0.9 cm in women. More than 1.2 cm is generally considered hypertrophic. This is common in hypertension, causing concentric hypertrophy or hypertrophic cardiomyopathy, often asymmetric hypertrophy. Left ventricular ejection fraction is the gold standard for how well is the heart pumping. Use the biplane method of discs, modified Simpson's rule. You must trace the endocardial border in both apical 4-chamber and apical 2-chamber views at end diastole and end systole. Ejection fraction is the difference between end diastolic volume and end systolic volume divided by end diastolic volume and multiplied by 100 to express as a percentage. Normal is 52 to 72% in men, 54 to 74% in women, and heart failure with reduced ejection fraction has left ventricular ejection fraction less than 40%, indicating significant systolic dysfunction. Left ventricular mass. While wall thickness tells you about a single slice, left ventricular mass tells you about the total weight of the muscle, usually calculated by the ultrasound software using the linear measurements, cube formula, or 2D area length methods. It is then indexed to body surface area, left ventricular mass index. Normal indexed value may be less than or equal to 115 gram per square meter in men and less than or equal to 95 gram per square meter in women. Square meter is body surface area. High mass indicates chronic adaptation to pressure, as in severe aortic stenosis or hypertension. Relative wall thickness helps categorize the type of remodeling the heart is undergoing. Relative wall thickness is equal to twice the left ventricular posterior wall dimension in diastole divided by left ventricular internal dimension in diastole. Normally it is less than 0.42. In concentric hypertrophy, there is high relative wall thickness more than 0.42 plus high left ventricular mass. In eccentric left ventricular hypertrophy, there is a low relative wall thickness, that is less than or equal to 0.42 plus high left ventricular mass, which is common in volume overload or in athletes. Always ensure your image is not foreshortened in the apical views. If the LV looks like a football rather than a bullet, your volumes will be underestimated and your ejection fraction calculation will be wrong.